Oh, what's up, Doc? Still whining about this healthcare law, Doc? What if we bribe you to like it, Doc? Don't laugh. This isn't so far-fetched. Tucked deep inside, actually not so deep inside the healthcare law, an incentive for doctors to treat Medicaid patients. They say incentive, but here comes some critics tell it, mandating 64% pay hikes for doctors. To do so, well, it sounds more like a bribe to Dr. Sreedhar Potarazu, who agrees. Doctor, even with that, it doesn't seem to be enticing a lot of your colleagues. Why not?
I think they got to be really concerned if they're watching today, Neil. I really think it sounds like a bribe to get coerced into taking new Medicaid patients, especially when they don't know what they're getting into. The deal is that the government is going to pay this down payment for just a couple of years to entice doctors to take on more Medicaid patients to try and match their reimbursement to at least as much as what they're paying for Medicare. But guess what? The proof is in the pudding here, because typically, and a study was published in Health Affairs not too long ago to show that the doctors that end up taking on Medicaid patients is directly tied to their reimbursements. The states that have the most people in Medicaid tend to pay the lowest in terms of physician reimbursements, and hence the government trying to kick in.
That's why I don't think even the 64% or whatever it's going to be will cover it. What I suspect, though, Doctor, and you're closer to this than I'll ever be, is that, look, you won't do it, with the sugar. Maybe we'll give you some vinegar. Maybe you'll have to do this. So take the money now, or we'll ram this down your stethoscope. But that's the next thing.
Well, that's exactly right. And I think they sort of are ramming it down the stethoscope, because what happens in a couple of years is that the doctors that now accept these patients, who then either have their payments cut back to where they were or even less than that, are all of a sudden stuck with a whole host of people that are now probably sicker than most, where they're going to erode into their profit margins of how doctors are going to stay afloat. It's almost like telling an airline that we'll pay you to take on all of this excess baggage for the next couple of years, but after 2 years, we're going to take those payments back or not pay you, but you still have to carry that excess baggage.
What about the idea, Doctor, though? It's volume, volume, volume. In other words, this is where doctors can make money. They're going to be able to have, many more patients, a guarantee in the government. We're going to give you a 64% Benny to get you in, and what you lack or what you're not getting now with a few patients making as much money, you'll get with a lot more patients, maybe getting a little individually less money, but net to you a lot more money. Is that even true?
Well, volume would make sense here if every state was in fact going to expand their Medicaid rosters, so that the math adds up in terms of volume times price means more money. But as you well know, the jury is still out in terms of whether every state will in fact expand their Medicaid roster. A lot of them are sitting on the fence for the fear that, look, we could be held holding the pot in a couple of years, especially if Obamacare stays in effect. And then we end up, in a bigger problem, bigger crisis than we are sitting right now. So volume doesn't really make up for it. And the other thing here is that physicians have their back to the wall. They always have. They have to take on sicker people, potentially take on lesser reimbursement. But guess what? Insurance companies would never put up for that. You saw the insurance companies that said if we had to take on more people with pre-existing conditions,
they jacked their premiums up. As if that was a news alert.
Up.
Yeah. All right, Doctor.
Yeah, doctors can't do that.
That's amazing. Yeah, that was always the great mystery to everyone. Why are these premiums going up? Hello?
Absolutely.
Doctor, thank you very, very much.